I'm a podiatrist. I'm in Sydney, in New South Wales. I've been in podiatry practice for a few decades now, 40 years in fact. And I've been increasingly moving more across into the field of or areas of chronic pain, arthritis management and things like that in recent times. I still have a general podiatry practice, still see all range of ages, different clinical conditions, etc. But I find I'm really attracting more of the complex pain problems, which I love because, it's great when you can help them. I think I first got interested in laser when I heard about the new high-powered units that were around. I knew laser had been around for a while, but it hadn't been traditionally embraced very much in podiatry. It allows me to give significant pain relief, the way I use my laser in conjunction with the other techniques I do, to a lot of patients and a lot of their clinical problems. So it doesn't matter if it's ordinary osteoarthritis, which of course to the sufferer is never ordinary anyway, or whether it's something more significant like some of the nasty arthritis like rheumatoid and ankylosing spondylitis. So what it's really allowing me to do is to change their pain at the first visit to the point that, pain management now, they think that maybe if you can just break the pain cycle for a while, maybe the brain even gets a chance to reset. And I think, that first stage of healing, being able to initiate it too at the first stage is really critical. And of course, it's only the beginning of the process. The patients need repeat treatments, obviously, to be able to achieve that. But it's really quite profound in its effect when you're using a high-powered unit such as the MLS. And the other thing is, of course, it's so easy to use. That's what really attracted me to it when I first saw that. Companies around like MLS that have used the 50 years or whatever of research to work out the optimum settings based on research and science that's been out there for some time is really fantastic. It simply means that the clinician can pretty much come up with their diagnosis, which of course is critical. If you don't get your diagnosis right, then laser's not going to work if you're treating the wrong area. On the whole, what most patients love is the fact that there's somebody still trying to do something to help, particularly if it's chronic problems, particularly if it's, there are many, many long-standing podiatry patients in my practice and many other practices. They've got lots of arthritis, for example, and plus people get new injuries, they fall off a ladder or they, one woman I've had great success with recently just sort of ricked her foot, as she called it, stepping off the gutter badly, and she had a tendinitis on her Achilles. It was about the third of a boiled egg, for example, and that responded brilliantly at the first appointment, which frequently happens. But of course you don't just laser it. I use kinesio tape and do soft tissue work and other things. We use foot strengthening orthotics and various other options. So the end result is though that people find it's convenient and they love the fact that it's pain-free. Well, as you know, sadly, steroid drugs have their own set of issues. People can have reactions to them in their gut, for instance. There's the issues with addiction, and I recently saw those figures where it's people in the US that have been on it for longer than, was it 4 weeks? I've forgotten the percentages. It was a significant percentage of them anyway are still taking them after 12 months, and that story of addiction is well known with some drugs. It's an alternative to taking prescription and over-the-counter even paracetamol and non-prescription anti-inflammatories. It's also an alternative to steroid injections, and it's interesting because it's not anywhere near as well understood as it should be, in my opinion, because people are historically now being referred willy-nilly for imaging when they've got heel pain and plantar fascia issues and forefoot issues that they think might be a Morton's neuroma or an irritated nerve in a particular spot in their metatarsal area. And of course, when the report comes back from the radiologist about the pathology they've looked at on image, if there is some there, they're increasingly recommending a form of treatment, saying, they may benefit from a steroid injection. And I find that curious because we don't get that where they're recommending other treatments. They don't say, may benefit from painkillers, for example, if it's back pain or something else, So really, the fact that this is such a simple modality to use, I think is partly, doesn't make it poorly understood, but it's certainly, when I say simple, it's not to be underestimated. It's a very potent modality, and of course the high-powered units such as MLS laser eye protection has to be worn, and the person using the equipment can use it easily, but they have to be well trained, of course, in all the usual safety factors and patient care generally.